So good afternoon and greetings from all of us here at the Tamil Hindu, the HR and the medical departments in Chennai. I am very happy to welcome and invite every one of you to this webinar on common urological problems. This is organized as part of our Arogya Raksha initiative, themed under the Employee Engagement Experience. I'm sure few of us would have experienced such disorders, or maybe our family members would have undergone some conditions or treatment for this urological problems. But one common trend that we see is most of us continue to suffer in silence rather than take immediate medical help. Today, there is a small change in our schedule. Dr. Ananthakrishnan Sivaraman, who was designated to speak to us, is unable to join us as he has to attend an emergency. But instead, we are privileged and honored to have with us Dr. P.B. Sivaraman, an eminent urologist and a senior surgeon, to talk to us on this topic. And he is Dr. Ananthakrishnan's father. There are a few things I would like to remind you. Kindly put your mobile phones or your systems in the mute mode, because there will be a lot of disturbances while talking and the audibility will be affected. The other thing is, after the presentation is over, if you have any queries, kindly type it in the question and answer box, so that after the presentation, the speaker would address the questions. Along with the speaker, we have a team of doctors, Dr. Ganga, who is also his student, Dr. Manju, and Dr. Meenakshi Sundaram. I now request our Senior Medical Officer, Dr. Meenakshi Sundaram, to introduce the speaker to us. Thank you.
Good afternoon, everybody. We are fortunate to have Senior Professor Dr. P. Sivaraman as our speaker today. He is the Chairman and Head of the Department of Urology, Chennai Urology and Robotic Institute Hospital. Dr. P.B. Sivaraman is one of the most experienced and respected senior urologists in the country. He worked as the professor and head of the Department of Urology at Madras Medical College. He is the first surgeon to perform cadaver kidney transplant in government institution. He is credited with nearly 2,000 successful kidney transplants. He has been honored with Doctor of Science by MGR Medical University. The Urology Society of India awarded Urology Gold Medal to him. In recognizing his contribution as a urology teacher, his students and assistant professors have instituted an endowment oration in his honor in the Urology Society of India. He is the founder member of Cancer of Prostate Endeavors, an organization involved in research and creating awareness of prostate cancer. Now to Professor Sivaraman. Sir, please, sir.
Can you hear me?
Yes, sir.
Good afternoon, everybody. Thanks for this opportunity. We are today going to discuss about some of the common problems in urology. If you see that there will be a lot of common problems, but I can select only 3-4 topics. One is prostatic hypertrophy, which is very commonly found in men above 50 years. And another is urinary stones. And the third is urinary tract infection, which is mainly concentrating on women. So first of all, we will talk about prostatic hypertrophy. Prostate gland, as you can see, is a small walnut-sized gland which is found below the bladder. Can you see? This is the prostate gland, and this is the urinary passage which is passing through the prostate gland, and it is helps to control the urinary flow. So from the bladder, it will have to come into the urethra, and the urinary passage is here. And it produces a fluid component for the semen where the spermatozoa can swim, and produces prostate-specific antigen, which helps in liquefaction of the seminal coagulum. These are all the main purpose of prostate gland. But actually, it is after the reproductive age, it is not of much use except a lot of trouble. Next. So you can see this is the bladder, and this is the prostate gland. Here only that seminal vesicle part comes and empties. So all the things combine together and come as a seminal fluid out of the urinary passage. This is the prostate. So what is prostate, benign prostatic hyperplasia? Nothing but this is normal prostate is like this. Can you see the bladder picture? Urine is here, and the passage is nicely separated. This is the prostate gland for normal people below the age of 50. Over a period of 50 years and above, prostate starts enlarging. If it enlarges, it narrows the urinary passage also. If it narrows the urinary passage of urine becomes difficult. So the residual urine is more in this, and slowly it increases, and finally they go in for retention of urine, not able to pass urine. This is the only thing that prostatic hypertrophy causes after the age of 50. Another point you should know is prostate enlarges in all directions. Here, 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 and behind, and also through the center. Only when it enlarges towards the urethra, there is a problem produced by the prostatic gland. If not, the person will not have any symptoms. So what you should not think is everybody above 50 should have prostatic hypertrophy and symptoms. It is not so. Depends on where the prostate enlarges, and it depends on the individual. Nobody can have a control over it. And it is not a disease. It is a part of aging process, like your cataract, gray hair, walking sticks, like that. Okay? Next. So, dihydrotestosterone is a small hormone which is produced in the prostate, can play a role in making the prostate bigger. And the important point is, benign prostatic hypertrophy cannot be prevented. It is an aging process. It will develop. But only thing is, when it develops and which direction it develops, depending on that, the patient can be having symptoms or no symptoms at all. Because one of my patients asked me, my father is 89, 90 years, he's got no prostatic symptoms. That means his enlargement is from other sides and not into the urethra. So not necessarily that every man should have a prostatic hypertrophy symptoms. Next. So there are two types of enlargement. One is benign prostatic enlargement and another is cancerous enlargement. Can you see this is the kidney, ureter, bladder, this is the prostate. These are the testicles in the scrotum. So, what is the stones in the kidney, in the urinary tract and hematuria and urinary tract infection can be some of the symptoms of this. Next. Other symptoms are weak urinary stream. And you see patients trying to pass urine into the commode, but it falls before that. And another is frequent urination. That means before you enter the toilet, patient feels like urgently passing. Sometimes he wets the undergarments also. Another is dribbling after the urination. After passing urine, you think it has completed, but there will be few drops in the undergarment, which is a very troublesome, and it can smell and give problem to others next door. The urge to urinary incontinence, the leakage of urine only when there is a full bladder. The overflow incontinence is called. Prostatic hypertrophy is completely obstructing, and then it is producing overflow incontinence. Next. BPH, when should the BPH be treated? Not all benign hypertrophy should be treated. It needs only treatment when the symptoms are severe enough to bother patient and affect the quality of life. Quality of life means, suppose he is not able to control urine, and before he gets into the toilet, he passes urine in the bed itself, and then floor is being spoiled. And these are all the things symptoms which spoil his quality of life. Another is renal insufficiency. Suppose the prostatic hypertrophy is large and long-standing, the kidneys get affected due to the obstruction. Then frequent urinary tract infections. These are all the indications where you should treat the prostatic hypertrophy. Next. So what causes this symptom? As I told you, this is the normal prostate. Urine is coming from here, urethra is here, and then enlarged prostate produces obstruction to the urinary passage, causes all these symptoms. Next. The first time defense against bothersome urinary symptoms is we should manage the condition. How we mean? You have to have the lifestyle modification. Suppose if there is a frequency of urination in the night, and the patient should avoid taking fluids after the time of 8 o'clock or 7:30 in the evening, and take a lot of fluid during the daytime. And they should avoid coffee and tea, which irritates the bladder and produces frequency of symptoms. So like that, lifestyle modification has to be done. And we usually advise very old people who cannot walk urgently to the toilet to have a stool next to their bed and have a urinary bottle so that they will sit up and pass the urine and keep it and throw it away in the morning. Because elderly people whose bones are very fragile, they may have a fall into the toilet and have a major fracture. So this has happened many times to our patients. So urgency can be treated, but also lifestyle modification should be done. There are two major planks for medical treatment of prostate. One is alpha-1 blockers. They are the medication which relaxes the prostate and provides a larger urethral opening. As I told you, the urethral opening gets narrowed, so the patient is not able to pass urine properly. For that, we have some specific medicines called prazosin, terazosin, tamsulosin, alfuzosin, viridozin. There are a lot of drugs which has come up now. Previously, 20, 30 years ago, prostate used to be operated all the time. There is no medicine. Now there is a lot of developments and lot of medicines are there. So this is called alpha blockers. Another is 5-alpha reductase inhibitor. This is the medicine which shrinks the prostate gland. The hyperplasia of the prostate is shrunken by this medicine. So these two things can combine together and make the prostate smaller and the passage larger. Next. So what should be waiting, as we told you, the treatment of prostate, then medications, and then some office therapies are there. And finally, we have to do surgery. Right. See this, you can see the prostate. This is the prostate, this is the bladder, this is the urinary passage. Okay. What we do is the prostate has got, there is since it is a prostate, medicine is a give alpha blocker, this separates the prostate. And this beta dutasteride will shrink the prostate size. Can you see? Shrinking the size and opening. Both combined together, it will shrink as well as open the prostate urethra. So the patient can pass urine easily. All these symptoms will be relieved. So main plank of treatment for benign prostate hypertrophy is only medication. 80 to 85% of people will be all right with medication. The only thing is they have to continue for a long time, nearly lifetime. Many people ask me, should we continue until lifelong? I used to say, for long life, we have to use this. Next. So the another things are surgical procedures. See, previously we used to open and remove the prostate, but now transurethral resection of prostate has come up. Most commonly done, it's gold standard surgery. We pass a small endoscopy through the prostate, and then with electrocautery and laser, we completely resect the obstructing areas of the prostate. It is called transurethral resection, incision, and laser technique. There are other things called balloon dilatation, prostatic stents are there, very rarely used because these are all the procedures which is mainly meant for people who are not fit for any anesthesia. Then we can use that technique. Next slide, please. If you see this video, these are all the instruments we use for this endoscopy. See, this is a cystoscopic view of the prostate urethra. We pass a tube. Can you see? This is the urinary passage. We are entering the prostate now. This is the prostate when you see by endoscopy. Now we enter the bladder. This is the urinary bladder. And we use the electrocardial loop. This is obstructing prostate. You can easily see that it is obstructing the urinary passage. What we do is, we do the resection of the prostate through these loops. Can you see? It is become slow, bits are all taken, and the bits are evacuated by a balloon evacuator after the operation. So the obstructing area is being resected, and the bleeding can be controlled by the electrocautery itself, so that you can coagulate the bleeding also. There won't be any bleeding. It's a very simple procedure. It takes about half an hour to 1 hour. Then we put a tube inside and keep it for 3-4 days. Remove it on the 4th day. Patient can do normal diet in the first day itself. Then you see the bleeding is being cauterized by this. This is called transurethral resection of prostate. Same procedure can be done by laser also. So by this, what we do is the passage is being completely widened. It is not radical prostatectomy. It is only resection of prostatic tissue which is obstructing the urinary passage, thus releasing the passage, making the passage bigger and passing urine better. So it is complete. See, this is the prostate. This is the resection, part of the resection, and then fully resected. Okay. So here you can see the prostate before resection, prostate after resection. This will be like this. So that the passage of urine is very, very nice. Next slide. So this is laser. The same thing is being done by laser. Okay. One part of it. This is the gap after that. This is the laser fiber which cuts and coagulates at the same time. All are same only. Next. So the other surgical procedures are suprapubic and retropubic prostate, laparoscopic prostate, and robotic prostate. It has come into vogue recently. The large prostates can be done by robotic surgery. Just like laparoscopy, we can also use the robo and do it. Next slide. The other procedures are heat coagulation, transurethral needle. They are not used very commonly. But if you know, there are some other methods also to do the prostate. That's enough. Next slide, please. So next we will go into the other complication of prostatic hypertrophy. Not complication, another problem. Prostate cancer can occur sometimes in the prostate after the age of 50. And the prostate, you can see the picture here. This is the cancerous prostate. It starts as a small nodule here. Then it spreads like this. Next slide, please. The treatment for those prostate is, one is active surveillance. It is localized. If they are very old, we can just see whether they are controlled by this, periodically checking the PSA and finding out. Next is the surgery. Third is radiotherapy, and then hormone therapy and chemotherapy. These are all available, but depending on the stage, the patient's condition and the requirement, we suggest the treatment accordingly. Next. This is the robotic surgery, which is a famous and very prominent surgery nowadays, and it has completely revolutionized cancer prostate surgery. See, the surgeon sits in the console. This is the robotic instrument into the body. This is small holes which are given for operating. And this is how we see the prostate. See, this is the bladder. This is the prostate. The robotic equipment will go and operate very precisely. The prostate alone will be taken out. Bleeding will be very minimal. The prostate, bladder and the urethra will be connected later. This is how, see the finger in the console room. They, with this finger, they do the movement for this and then make it convenient. It is a modern thing and it is very commonly catching up now. Next slide, please. So, how to detect the prostate cancer? PSA screening test. PSA is a enzyme which is produced by the prostate for liquefying the seminal coagulum, but that is only circulated in the prostatic tissue. So, if it comes into the bloodstream, then the PSA level rises. If the level rises, that means there is some problem with the prostate, not necessarily cancer. It can come in the infection of the prostate, injury to the prostate, and also post-catheterization and post-operative cases. So just PSA rise alone is not a diagnostic of prostatic cancer, but PSA screening test after 55 years is mandatory in developed countries. If the family history, the father has got a prostatic cancer, then this person at even 45th year, it should be screened. And then digital examination, rectal examination by the urologist is mandatory above 50 years. At least once in a year, they should get it done. Or it should be included or incorporated in a master health checkup scheme, PSA and digital examination. See, after checking the PSA, it seems the cancer prostate death has decreased up to 30% because of PSA screening and early detection of prostate. As I told you many times in many meetings, you should never be afraid of cancer. You should be afraid of not detecting it early. That is the only clue in this. If you detect the cancer early, any cancer can be treated successfully. So give us the doctors a time. Next slide, please. So this topic is over now. And I think we'll go to the question and answer last. Next is, we'll talk something about urinary stones, which is another common problem faced by people in urological disease. This is the picture of the kidney. You can see the kidney. This is kidney stone in the pelvis. This is the pelvis. This is the calyx. Calyx is the collecting system. And this is the stag-on calculus. Stag-on means it is like a horn of a stag, the deer. So 1, 2, 3 branches. These are all long-standing stones in the kidney, which was very common in previous days. Now, because of the advent of your ultrasound, this has become very rare now. So the stones can be in the ureter, the stones can be in the bladder, or the stone can be in the uretero-bladder junction. So what happens because of the stones? Stones is, this is the stag-on calculus, this is the urethral calculus, bladder calculus, this is urethral calculus, this is the below urethral calculus, which obstructs the urinary passage, and this is a calculus which is in the ureter. There is a back pressure effect and it is called hydronephrosis due to the obstructions in the prostate ureter. You get the backlog of urine. Right? Next slide. So, renal calculus, 2 out of every 1,000 men, they get renal calculus. This is the calculus in the kidney. And 3 times more men get it than women. This is one of the good points for women. They don't get stones so frequently like men. Next. No, the types of stones are calcium stones, uric acid stones, cystine stones, and oxalate stones, struvite stones. There are types of stones according to the solid state. Next slide, please. Factors that affect normal balance of urine can cause those. The factor that affects the normal balance of urine, decreased fluid intake, dehydration. It's the commonest cause of our stone formation. And then urinary stasis. Crystals precipitate more readily when there is a stasis of urine. And then urinary tract obstruction and immobilization. All these things can cause kidney stones. See how the kidney stones occur in the kidney. Can you see this kidney picture? Small stone which starts coming down. See, they have usually the rough edges. Can you see the stone? Which is rough edges. So when they move, they produce pain, rubbing against a very sensitive mucous membrane. Can you see? When they move, it can come out through this into the bladder and pass out. If it is less than 6 millimeter. But if it is more, if it is rough edge, they produce bleeding by irritating the mucosa and very difficult to come. That's why we get pain. They get stuck here also. So this is the reason why we get pain in the urinary stone when it passes down. When it is inside the kidney, it doesn't give any pain. Next. So there are some preventable risk factors for stones. One is dehydration. Dehydration is very common, especially dry heat. That's why we get in Delhi, Chandigarh, and some other places in Andhra, we get dry heat. So they don't sweat. So what happens is the water intake is very reduced. So they get concentrated on urine. Then the salts get precipitated and form urinary stones. And there is some dietary factors also. They can be excessive vitamin C or vitamin D, and sometimes activity levels are very low also, they'll get stones. So immobilized patients like paraplegics who lie down in the bed for years, only move left and right, and not moving, walking. Those people, there is a backlog of urine in the posterior aspect of the bladder where they have stone formation. So low urinary output is one of the reasons. Recurrent urinary tract infection also can cause stones, and abnormal pH are very low or very high pH. Next. So what are all the examinations we do? History and physical examination have to be done, and then urine analysis and culture, and then ultrasound, KUB, IVP, and CT scan. These are all the standard investigation depending on the thing. How to treat them? ESW, extracorporeal shock wave lithotripsy. That means from outside, a machine generates shock waves and concentrates the shock waves at the stones in the kidney and breaks the stone. This is called ESW. Okay, this is a very non-invasive technique which is used for stone breaking in the kidney. Not all stones. Most of the some of the stones can be broken with this method. Next. Then we have to put a tube inside the urethra and remove the stone. See, we put a tube inside the urinary passage into the urinary clot. This is the ureter in which the stone is there. We bypass the stone and then produce a small basket like this, which will hold the stone from moving out. This is a laser which produces the laser energy to powder the stone. Once we powder the stone, it can be completely removed. Can you see? The stone will come out through this urinary passage itself. Next. So another method is putting a small pin hole into the kidney from behind, and then we can break the stone by the laser fibers. So even if a big stone or staghorn calculus, it can be done by a small stone hole in the back, and you will completely remove the stones from the kidneys. These are all very, very non-invasive. Nowadays, it is done very commonly. Previously, they used to open a big incision and take the stone. So this is the PCN. So this is the way we take the stone out. This tube can be removed after 3-4 days once the wound heals. So this much about stones. So finally, we'll talk about urinary tract infection. I think I'm exceeding my time of half an hour. I'll do it very fast. This urinary tract makes the stones. See, what is urinary tract? This is only basic. The urinary tract makes and stores urine, one of the body's liquid waste products. The urinary tract includes the following parts: kidneys, ureter, and bladder, and urethra. Can you see the picture? So, urinary tract infections. Next. So, the infection of the urinary system. This type of infection can involve your urethra, kidney, and the bladder. So in the bladder is involved, it's called cystitis, kidneys are involved, it's called pyelonephritis. And your urine typically doesn't contain bacteria. Normally when the urine is produced, no bacteria is produced along with the urine. The waste products are just excess water is sent from the kidneys to the pelvis, ureter and bladder and urethra. But urinary tract is invaded by the bacteria. Bacteria get into the urinary system from the outside the body, causing problems like infection and inflammation. This is urinary tract infection. Next. So urinary tract infections are caused by microorganisms, usually bacteria, that enter the urethra and bladder, causing inflammation and infection. Though a UTI most commonly happens in the urethra and bladder, bacteria can also travel up the urethra and infect your kidneys. More than 90% of bladder infections caused are E. coli, which is a bacteria normally found in our intestines. Next. So what are all the symptoms? Strong, persistent urge to urinate, urinary sensation when urinate, burning sensation when urination, passing frequent small amounts of urine, and cloudy urine passing, and urine that appears red or blood in the urine, strong swelling urine, pain in women, especially in the center of the pelvis. Neck. Women tend to have urinary tract infection more often than men. As I told you, prostate is only found in men. So all the problems of prostate is for men only. For women, there is some small problem in urinary tract infection alone. They get it more often because the urethra is shorter in women. Can you see? The urethra is shorter in women. Men have got a long length of urethra so that the bacteria is difficult to travel up to the bladder. Whereas in women, easily they will travel into the bladder. Next. So urinary tract infections are common in women and many women experience more than one infection during their lifetime. Because of female anatomy, as I told you, the distance is very short. And sexual activity. Active women tend to have more UTI than the women who aren't sexually active. Having a new sexual partner also increases your risk. Certain types of birth control. Women who use diaphragms and birth control may be at higher risk, as well as women who use spermicidal agents. Menopause. After menopause, decline in circulating estrogens causes changes in the urinary tract that makes you more vulnerable to infection. What happens? The mucosa will get, very dried up and shriveled after the age of menopause. So the bacterial invasion from the outside into the bladder is very easy. So the post-menopausal women have more chance of getting this. And also, normal urinary tract infection is also common, but abnormality in the urinary tract will be they are more prone for infection, like block in the pelvic junction, block in the ureter, block in the urethra. Babies who have vesicurity reflexes, posterior urethral wall, they are all having increased risk of UTI. And kidney stones, enlarged prostate, that can also cause more urine because they trap the urine in the bladder and increase the chance of UTI. So another thing is suppressed immune system. When the immune system is suppressed, like when the people are having some cancer, they are on chemotherapy, kidney transplant patients who are on immunosuppression, diabetes, and other immune system depressing diseases, the body's defense system against the germs is lowered, then it can cause an increase in UTI. And catheter use, people who can't urinate on their own use tubes, catheter, that increases the chance of urinary infection. There are also some people who have neurological problems, like they don't have normal passage of urine by themselves due to the lack of nerve stimulation, paraplegic patients who have a continuous urine catheter training. They will also have the chance of more UTI. A recent urinary procedure also, somebody who had a cystoscopy or catheterization or dilatation of urinary passage, they also get urinary tract infection more commonly. Complications of urinary tract. What is the problem in urinary tract complication? Recurrent infections, especially in women, in 6 month period, 3 to 4 times in a year. The permanent kidney damage also can occur due to chronic pyelonephritis. Infection in the kidney, which is constantly coming, not treated properly, can affect the kidney and spoil the kidney function. And the increased risk of pregnant women have delivering baby, which are birth weight is low or premature infants is also. Next slide. Urethral narrowing, stricture in men. That is the commonest cause. Previously, urethritis, previously due to gonococcal urethritis. Due to unprotected sex with other women, they can have a gonococcal infection. Those infections produce narrowing of the urinary passage in men. So, they will get stricture urethra. These people get urinary tract infection more commonly. Sepsis, a potentially life-threatening complication of urinary tract infection is sepsis. The bloodstream, the toxins and the bacteria enter the bloodstream from the kidney, and the entire body gets the septicemia. This is a very life-threatening disease if it is not treated properly. So urinary tract infection should be readily diagnosed and treated as early as possible, should not be ignored. Next. So how to prevent the urinary? Simple method of drinking plenty of liquids, especially water. Drinking water helps dilute your urine and ensure that you urinate very frequently and allowing bacteria to be flushed out of the urinary tract before an infection can begin. And then drinking cranberry juice, they say it reduces the adhesion of bacteria to the bladder, but it has not been proved very well by all the literature, but it is unlikely to be harmful. Next slide, please. Wipe from the front to back. This is also not proved scientifically, but people advise always that when women urinate or defecate, they should wipe from front to back and not back to front. Because when you do from back to front, anal area, which contains lot of bacteria, will enter your vagina. From there, it will enter the urethra. So do not wipe from front, wipe from back. And then empty your bladder soon after intercourse. It is sexually active women, they should drink a full glass of water and then pass urine, wash, then only go to sleep, because after intercourse, if the bacteria stays inside the bladder, if the patient is not passed urine, that will multiply inside the bladder. So we advise them to pass urine, then only go to sleep. And avoid potentially irritating feminine products. Using deodorant sprays, feminine, such as douches, powder, the genital area can irritate the urethra and produce infection. So we avoid that, to allow them to avoid. Next. Change your birth control method. Diaphragms and unlubricated, spermicide treated condom can also contribute to bacterial growth. Next. So how are the urinary tract infections diagnosed? This test will examine the urine analysis, find any bacteria, pus cells, or any blood in the urine. In urine culture, we will know what type of bacteria is in the urine and what type of antibiotic can kill that. So urine culture and sensitivity will decide how to treat you. Next is blood test. This is urea sugar creatinine to find out whether you have diabetes or renal failure or some other problem. Next. So there is other recurrent urinary tract infection. You should do ultrasound KUB to find out any, as I told you, structural abnormalities in the urinary tract can cause urinary infection. And then CT contrast also, and cystoscopy finally to find out any blockage in the urinary passage. Next slide. So treatment. Treatment is done by appropriate antibiotics for uncomplicated UTI, according to the urine culture report. You send the urine culture, get the antibiotic, and then treat them accordingly, whichever is the sensitive antibiotic. But it is very important not to stop taking the antibiotic because your symptoms go away and you start feeling better. Many people do this. After 3 days, they stop the antibiotic. If this is done, the infection is not treated completely with the full course of the antibiotic. It can come again. So that part of the bacteria would have been died, the other bacteria will thrive and then allow the urinary tract infection to come in. So you should never stop the antibiotic without the full course. Good. Thank you very much. Sorry, I've taken 10 minutes more.
So thank you for a very, very interesting session, sir. Very clearly explained. There are a few questions, sir, that they have put in the chat box. There is one question which is where Mr. Surya Prakash has asked, are robots used for surgery only when the doctor is not present in the place of surgery?
No, this is a very common misconception. Robot is only activated by the doctor, but he need not be next to the patient. It can be 2 feet away in a separate room also. So he sees it in the big video screen, whatever happens inside the body, and accordingly he manipulates his instrument from outside. The doctor has to do this. He cannot do alone. The robot cannot operate alone. It does not get. Okay.
Thank you, sir. The other doubt that I have is, sir, can you just tell about phimosis, sir?
Yeah, phimosis is a common condition in many children. From birth also is there.
Yes.
Inability to retract your preputial skin behind. Then the glands will not be exposed. So there is a lot of infection between the preputial skin and the gland because it cannot be cleaned every day. Normally people should retract and clean it twice a day. Then only the hygiene will be maintained. If children who cannot retract for some time, up to 1 year you can wait. If this comes, sometimes they will retract automatically. And you can even try retracting mildly while doing the bathing of the children and see whether the meatus, urinary meatus is seen through the skin. If that meatus is not seen even after 1 year, you have to operate the circumcision has to be done.
Okay. Thank you, sir. There are 2 more questions, sir. It's from an anonymous attendee. Are there any risk factors for recurrent UTI? I think you mentioned it in your talk.
Yeah,
do you have any risk factors for recurrent UTI?
Yeah, risk factors only. Any obstruction to the urinary passage, post-pneumonia movement, distal urethral stenosis, where there is urinary passage is obstructed, the residual urine is more. These are all risk factors. Stones in the bladder, catheter in the bladder, and blockage of the pelvic junction, anatomical abnormalities in the urinary tract, which will give recurrent urinary tract infection. Otherwise, incomplete treatment and the cause of urinary tract infection, which came in the first period, is being repeated again. As I told you, not to wash from here back.
Yes.
Those things you don't do, you can get recurrent urinary tract infection.
Okay. Thank you, sir. Then, is susceptibility to recurrent UTIs genetically inherited? Is it genetic, sir?
No. Genetic, it has not been proved that genetically there is any preponderance. But genetic abnormalities like, urinary passage stenosis can come. Suppose polycystic kidney is there is obstruction to the urinary passage, pelvic junction is there, that can come genetically. But the recurrent urinary tract is not genetically preponderant.
Sir, I have a question. What are the symptoms that should alert a person to have a urology consultation? The common symptoms that you see.
In which disease, madam?
Anything related to the genitourinary system, like bleeding, the pain, or anything.
Madam, urinary tract infection, mouth, face, ear, motion, where blood is not allowed except blood comes in any of these holes, it has to go immediately to the doctor. So hematuria is a very important. Nowhere it is allowed, except menstruating women. Otherwise, no blood anywhere, not even a drop. So that is one of the indications. Like other things like urinary tract infection, pain, and the difficulty in passing urine in prostate.
Okay. I have a question, sir. Those who are having history of renal stones, whether they should follow any diet control, sir, whether they have to avoid anything in specific.
Yeah, there are the specific diets that are given for each stones, oxalates, triple phosphates. Normally, they should take 4 liters of water, sir. See, any stone which forms like a sand only, sand becomes like a pepper. Pepper becomes like a big seed. So when it is in the sand type, if you take 4 liters of water, it will be flushed out. So no stone, we don't need to worry about how many stones are formed. As long as they don't stay in the kidney or in the urinary tract, or they don't become bigger. Okay? So plenty of water. And also avoid things which, if you analyze the stone, you know what type of stone is here. Now there are a lot of diet charts which I can paste you in the thing. There is clear diet chart, 20, 30 things which you should not say. There is only a guideline, because they'll say non-vegetarian, no mutton, no chicken, no prawn, no fish, like this. But they cannot stay like that. So you have to avoid excess in anything. So pasalakira, palak are supposed to be reduced. Tomato and brinjal and oxalate stone. What happens is they all say tomato seeds are causing the stone. It's the commonest mistake. Tomato seeds are not causing. It is the oxalates inside the tomato which causes. Whether you have the seed completely also inside, stone will not come. Many common misconception is rice, there is lot of stone. My wife did not do it properly, I got stone. Nothing which goes by mouth will form a stone, because stones cannot go into the intestinal tract to the renal tract. It has to be absorbed in the blood, go in the circulation only in the kidney. So it is a common mistake that no seeds taking will produce stone. No stone taking will produce stone. Stones are produced in the blood due to other salts, oxalates, phosphate, calcium. They get precipitated. So nothing to do with your stone and seeds.
So just one question, sir. When you mentioned about hematuria, when we do a master health checkup and patient comes with just 1 or 2 RBCs present in the urine routine, what should we do? So patients, they become panic and come to us.
Not 2 doesn't matter. If given during menstrual years, 1 or 2, 3 to 4, we have to investigate one, because urinary tract will only show occasionally one small drop of blood. If you miss that, 6 months later you will have another bleeding. By the time the growth of cancer in the bladder will be 1 or 2 centimeters. So hematuria, 1 or 2 doesn't matter. 3 to 4, even in once, is worth doing at least a urine culture and ultrasound to see whether there is any problem. I don't think we should ignore that.
Okay.
So there are a few more questions, sir. One question is it restricted water? No, is restricted water intake advisable before going to bed? This is from Mr. Vijay Raghavan.
No, restricted water intake need not be done routinely for everybody. It is for people who are above 5 to 60 years, who have a prostatic hypertrophy, and who have a frequency of urination and nocturia. In the night time, they are disturbed 3 to 4 times. Then only we should restrict. Otherwise, nobody should restrict fluid intake, because it is not good for health. But people who have prostatic hypertrophy, who are old and not able to go to the toilet 4 or 5 times in the night, they can restrict the fluid so that the number of times going in the night will be reduced. But having said this, an important point you should know is, above the age of 60 years, patient going to the urine toilet, even men and women both, is normal. Because normal time from evening 6 o'clock to morning 6 o'clock, the urine production was only 3/4 of a liter when you are young. Above 60 years, the diurnal variation takes over. Kidney itself produces 1.5 liters of 1 liter in the night. So our capacity is only 500 ml. Naturally, when the kidney is producing more urine, you have to go to the more often. That is not a disease. So 1 or 2 times, don't say it is a disease and give medicines for that. More than that, then you can restrict the fluid and see. Above that, you should use the medication. Never reduce the night urination by medication, which is not good.
Okay. Thank you, sir. There's a person who has asked, in which age is it affect? Does it affect? I think you've already answered the question in the previous query. The next question is, what are the precautionary measures that we need to take to avoid BPH disorder, doctor? This is from Mr. Lisbon Kumar.
Mr. Kumar, I'm sorry, you can never ever prevent BPH. BPH is an aging process. Just like our gray hair, it will come. Okay? But whether it is producing symptoms for you or not depends on which side the BPH enlarges. As I told you, it can go behind, it can go in the side and front, and also it can go into the center and produce obstruction to the bladder urinary passage. Only when it produces obstruction to the urinary passage, you are having problems in passing urine. So BPH cannot be prevented, but it can be managed with medicines alone. But all BPH need not be treated. As I told you, symptomatic BPH only should be treated. And actually, there is an Australian, if it's interested, there's an Australian research which said, not completely proved, 35 to 50 years, if the patient has got 3 times ejaculation during a week, ejaculation by masturbation or sex, whatever, their chances of getting cancer prostate is less. You understand? 3 times a week ejaculation may prevent cancer prostate at the age of 60 because celibacy will have more congestion in the prostate and they are more prone for prostatic cancer. But this is not completely proved, but this is going on. The research is going on.
Thank you, sir.
So why is the urinary tract infection common during pregnancy? You see a lot of pregnant women coming with infections.
There are 2 things, madam. One is hormonal difference, madam. See, there is some relaxing hormones, smooth muscle relaxing, secreted in pregnancy. That relaxes the ureter also. So what happens in pregnant women, there is ureteric dilatation and slow egress of urine from the bladder. Another thing is the uterus will press on the bladder and not make the urine completely pass. Some the residual urine will be there. And sometimes the frequency is due to small capacity of the bladder due to uterus pressing on it. And these are all the things which and so discharge sometimes not very clean, very properly. All those things will cause because it is very close to the vagina.
Okay.
What happens is the bacteria normally due to the estrogen, the mucosa will be very bumpy. It will not allow the bacteria to enter the bladder from the urethra. But once menopause comes, the dryness, then the flattening of the mucosa, naturally the person's bacteria will easily go. Like that, pregnancy is one of the vulnerable areas at the time.
Okay.
Sir, what is the early symptom of cancer prostate one should not miss, sir?
There is no early symptom of prostate. All the symptoms will be like of benign hypertrophy only. Frequency, urgency, everything. Hematuria, blood, that can come in benign also, and anything, blood comes in. Another thing is, same symptoms, night time getting up late, difficulty in passing urine, burning maturation, straining to pass urine, incomplete passing urine, leak in the urine, return, everything like BPH. But we have to be careful, the digital examination and PSA to be done. As I told you, in 50 years, PSA should be included in the master checkup so that they will not miss anything. PSA screening has reduced 30% of CA prostates in the world from dying.
Thank you.
Yes. So Mr. Satish Menon has asked, while doing a yearly master health checkup, do we have to do any additional checkup that we can identify about our urological condition?
Yeah, the master health checkup includes the urea, creatinine, sugar and all.
Okay.
PSA has to be included. Many of the master health checkups do not include PSA, and then ultrasound KUB and a digital rectal examination by a urologist or a general surgeon.
Okay.
3 things if we include, we can suspect. Then we can further investigate and confirm the diagnosis of the prostate.
And this will be recommended for men above which age group, sir?
If there is no family history of cancer, above age of 50, 55.
50.
If there is history of family history, whose father or brother had the cancer, then it should start investigating from 45 years.
Earlier. Okay.
Little earlier.
Thank you, doctor. Mr. Bala Saravana Kumar, he has asked, dear doctor, what is the limit of water intake that we need to consume to maintain our kidney properly?
3 to 3.5 liters is a normally recommended thing. It again depends on the type of work you do. Suppose if you do an outdoor work completely in the sunshine, you will lose more water. Suppose if you are only sitting in a desk in an AC room, you may not require so much water. Liters will be very, very normal. But I have seen people who are working previously in the mines with the, gold mines and other mines. They use 10 liters due to evaporation. They have to take up to 10 liters also. So it is not that it is a standard thing. It depends on the person's work and the place of work, how he is sweating, all those things.
Thank you, sir. And there's one more. Oh no, I think CuriHospital has posted that they are hosting a free screening blood test Euroflow urological consultation on the 18th of September 2021 between 10:30 a.m. to 2:30 p.m. and all prostate problems do not necessarily mean it's a prostate cancer. Therefore, we can go and screen. I do not know where they are doing it. Rama, can you just post where it is being done so that I can announce it?
It's done at our hospital itself, ma'am.
Okay. Yeah. Thank you. Fine.
Malini, there is one more relevant question.
Yes. Yes.
How to identify kidney-related problems in children? And what are the major causes of urinary infection in school-going children?
Yes, ma'am.
School-going children, madam, one is not drinking enough water and using unhygienic areas to pass urine, and phimosis, madam. Men children will have phimosis, cause urinary tract infection. Otherwise, there is nothing particular that children will also take.
So, Mr. Ashokan has a query, sir. He says, someone says drinking water after RO treatment is not healthy. It removes all the natural minerals from the water. Is it true? Do you have any opinion, sir, on this?
But in this RO treatment, I don't know how they do it. But RO treatment water, many people are taking. I have never found anybody having any of that. Maybe it can be only anecdotal. I didn't do a double-blind trial to tell you what is right, what is wrong. So you cannot take my word for it. But I have taken RO water, nothing has happened.
Okay.
But it may be an anecdotal. We cannot say it for everybody. So I am not an expert in that water.
Thank you, sir. So, Mr. Surya Prakash had posted the first question. He's come back again with continuing the same thing. That is, he says, if the doctor is going to operate, then why do we have to use a robo?
Super question. See, robotic instruments, if you can see my hand there, the doctor can move this way.
Yes.
Okay? The robot moves all the 4 or 5 directions. And you can bend this way, that way. And it can have a very precise movement. The small shake in the hand also will not be there. And the picture is 4 times bigger in the screen. And the robo can be controlled so well, we don't even lose any blood. First, the laparoscopic can be done in the prostate same way, like robo. But only thing is, the man has to do it physically for 4 hours. And he cannot do more than 1 or 2 operations. With robo, they do up to 9 operations a day. Same person, the doctor. In the Florida, where Ananthakrishnan trained, they do exactly 8 to 9 robotic radical prostatectomy every day. They have 3 robots, but 1 person only do it. So, number of cases can be done more precisely without any tiring thing. The laparoscopy man will be tired within 3 hours in the first case itself. And there is human error a little more. The precision will be little less. But not that it is laparoscopic prostatectomy is bad or anything. But this is the advantage of robotic surgery.
Sure, sir.
It will be same in both. If they are a good laparoscopic surgeon with hand, that also can be done.
Thank you,
the
sir.
duration of procedure will be less and simplifies the procedure.
And the blood loss is fantastically less.
Okay.
So there's one more question, sir. Sir, is prostate enlargement? No, I think you've already, it's the same thing. He's asking whether it's a hereditary problem, and I think you've already answered that it's not. So thank you, sir. Thank you so much for your patience and for your, very clear explanation. I would like to tell you that there were almost 90 participants who had linked in for today's program, sir. And dear colleagues, we also have attached an evaluation form. So after the program is over, if you can give your feedback, we'll be really happy to get your assessment. And I request Dr. Manju, our Chief Medical Officer, to close this event. Thank you.
Thank you, Malini. On behalf of the Hindu group, it gives me great pleasure to thank Dr. P.B. Sivaraman, Chairman and Senior Consultant Urologist, CuriHospital, for his valuable time he spent with us today. Today's talk mostly on the common problems we face. Almost most of us would have faced everything like urinary stones, urinary tract infection, and prostate-related problem. Was very, very informative to all. And thank you very much, sir. And we would like to thank Mrs. Gayatri Ananthakrishnan, MD, CuriHospital, Ms. Rama, and Mr. Raja for facilitating this program. Then I wish to thank the management of the Hindu Group of Publications, editor of the KSL Media Limited, our senior leadership team, and all the participants in today's program. And thank you, one and all.
Yes.
Thank you, madam.
Thank you, sir.
Thank
It was
you.
really enjoyable. Thank you, sir.
Right, madam. Thanks.